and welcome to the latest podcast in the ECIST Bitesize series. So today I'm joined by my colleague Chris Green. Do you want to introduce yourself?
Thanks, Pete. Yeah, my name's Chris Green. I'm the Head of Information for the Emergency Care Improvement Support Team.
Brilliant. Thanks, Chris. And my name is Pete Gordon. I'm Head of Emergency Care Improvement with the Emergency Care Improvement Support Team. So today in this brief podcast, we're going to talk about the ECIST dashboard, Chris. So can you just give us a bit of background about the dashboard that you've developed?
Yeah, no problem, Pete. So this dashboard was created around about 3 to 4 years ago. It was initially designed just to help support the Emergency Care Improvement Programme that we started supporting 28 systems. It's data that is automatically collected from every organisation provider in the country. They supply it on a daily basis relating to various urgent emergency care data metrics. And what we wanted to do is we wanted to show this data in a slightly different way than has historically happened. We wanted it down at a site level rather than at a trust level, representing some of the organisations that we were working with. And we wanted to show it in terms of measurement for improvement rather than measurement for performance, which is not necessarily a bad thing, but we wanted to help organisations look at their improvement journey, not necessarily just what the data was showing.
Yeah, brilliant. And so tell me, how many people does the dashboard go to? How many people are on the circulation list?
Yeah, so when the dashboard was, we were only working with those 28 systems, and so it probably went to, I don't know, about 100, 150 people, both within our internal team and within the teams that we were helping and working with in those individual organisations. But what happened relatively quickly was that other organisations geographically close to those particular sites learnt about it, saw the data, and they wanted to get their data into it, which was not a problem at all. And then before long, the individual regions for NHS England and Improvement started to hear about it as well. I thought it was quite a novel approach, both reporting it down at a site level and as a measurement for improvement basis as well. And so it started to kind of blossom from there, really. It quickly kind of went to all the different regions, and so we had internal people at NHS England and Improvement starting to use it, and then more and more people from individual organisations. And so now, from a baseline of about 150 people, it probably goes to about 2,500 people now, and they are in all walks of life. So we're not just talking kind of operational and clinical people, but also talking in my kind of sphere, which is different types of analysts, both in terms of acute providers and also CCGs, and like I said, within the regional teams as well.
Brilliant. And what's the feedback been around the dashboard?
Yeah, that's a really interesting question, because I think historically we've kind of not sought that from people. We've just kind of gone, here's a piece of data that we think you would like, here's a dashboard that has been built with operational and clinical people in mind, really kind of focusing on that end user. But recently, I kind of thought it is good to learn and evaluate from things that you do, and that's just not type of learning about the impact that you're having on in terms of patient safety outcomes, but also about other things that you do, and I classify that in kind of once again like my world in terms of analytics. You really do need to be listening to people, and so I sought feedback from those 2,500 people. I'll be happily to admit that not 2,500 people responded. However, we did get a good response rate, and around 98% of people found it useful. There are a couple of people that had changed roles recently, and so they wanted to come off a distribution list, which is absolutely fine. But actually, we've got a response rate and approval rate of around about 96, 97% find it useful. But more importantly, because of the way in which we've developed it with people, end users in mind. Not only that, but they can use the data effectively. Their measurement for improvement, skills and expertise has improved and increased. And we've also got more people able to navigate and find questions find answers to questions that they historically thought were not possible. And initially, if we went back a couple of years, they were relatively simple questions. It was just kind of like going, what's happening with attendances, what's happening with long stay patients, what's happening with our bed occupancy. But now they're asking more intriguing questions as well. And that's things like, what is the relationship from the emergency department onto our acute wards, onto our acute beds, and how does that impact on overall flow and the 4-hour performance. So it's been a really interesting experience over the past couple of weeks, and something which I've really been interested in.
Yeah, so just briefly, can you talk us through the top sort of 3 things that, the dashboard can help with?
Yeah, absolutely. So as I've talked about through this interview, that the kind of the main one was about measurement for improvement, and what the data will automatically do for you is it will identify things that are statistically significant. So, stuff goes up, stuff goes down all the time, okay? And some days, particularly if we kind of have a look at the past couple of weeks, it's been in the press relatively recently on the BBC website this morning around the increase in activity at emergency departments. Now, what we want to be able to focus on is that statistically significant? Is it statistically high, or is it just a slight increase? Because there's a vast difference in something that we need to do. If it is just slightly high and within normal variation, it's not really something we need to pay much attention to, and actually we can focus on areas that we should do. And what the dashboard will do in the top instance is highlight all of the individual areas which are showing statistical variation. So it will automatically draw your attention to it. What it will also do, the second point, is it will allow you to delve deeper into each of those metrics. And so, for example, if it was showing that our bed occupancy was statistically increasing, you could go down and have a look at that over a long time series to have a look at the past 3 months. And it's the dashboard is designed for relatively short to medium term improvement work. It's not designed to have a look at this time last year, 3 years ago, etc., etc. It's designed to do that. And then the third most important part of the dashboard is the area that allows you to have a look at the relationships between various different metrics. And in the NHS, I think we're very good at just looking at one metric in isolation. So we'll just look at 4-hour performance, or we'll just look at bed occupancy, or we'll just look at attendances. But actually what we want to be able to do is, well, that's really interesting that one metric has gone up, but the one's gone down. Now, for any statisticians out there, it's not kind of saying there is a correlation between the two, because they could be completely unrelated. However, we do know about the good composite metrics of flow, and if you are able to have a look at that on the relationship graph, it does allow you to dig into that in more detail.
Brilliant, thanks Chris. So final question for people who are listening to this podcast is, where can people access the dashboard? What's the easiest way for them to see it?
Yeah, absolutely. So we've got our own ECIST NHS Futures webpage, but probably the easiest way to access it is to email me. My email address is chrisgreen@nhs.net. No dots or numbers in my name. I got in there nice and early. I'm also on Twitter at chrisgreenNHS, and I'm more than happy to be contacted via any of those ways. And so if you want to get access to that, please let me know.
Brilliant. Thanks ever so much, Chris. It's always fascinating speaking to you, and we're going to do another couple of podcasts focusing on the ED staffing tool that you've developed and the bed modelling tool. But for now, thanks very much, Chris.
Thanks, Pete. Take care.